Introduction of the catheter. Having found the ureter mouth, the beak of the cystoscope is moved and turned toward it until the lens is less than 1 centimeter away from it and a little to its inner side, so that we are looking at approximately 4 o'clock for the right ureter. The corresponding ureter catheter is then pushed in until its tip appears, crosses the cystoscopic field, and passes just beyond it. Then the lever is elevated enough to bring the tip back into the center of the field. After this, levers and catheters are kept rigid while, with cystoscope and catheter acting as a solid body, the tip of the instrument is depressed until the tip of the catheter touches the mucosa just proximate to the ureter orifice. Then, again, using catheter and cystoscope as a single solid instrument, it is pushed inward until the tip of the catheter distinctly engages in the orifice of the ureter. With the cystoscope held very steady, the catheter is now gently pushed into the ureter orifice. If it has caught in the mucosa, it is gently withdrawn, turned a trifle, and reintroduced. It is quite likely to be caught at about 1 centimeter within the ureter orifice, and again at a depth of 5 centimeters. It passes the tight point where the ureter issues from the bladder wall. These are not points of true strictures, but of normal irregularities in the ureter. If the flute-tipped catheter will not pass in, it must be exchanged for an olivary-tipped instrument. Beyond 5 centimeters, the catheter usually goes readily enough, though in the normal ureter it may catch again at 15 centimeters, where the ureter crosses the pelvis, or between 20 and 25, where it enters the kidney pelvis. One must remember, however, that the mere contact of the ureter catheter always abrades the ureter wall. This abrasion is disclosed by the ureteral epithelia that are always seen in specimens obtained by ureter catheter. Therefore, the catheter should be passed up the ureter with utmost gentleness and without the least haste, so that the canal may be given opportunity to mold itself to the rather stiff instrument.